KKH at Home. Home Phototherapy. This video will explain the home phototherapy program for babies with jaundice requiring treatment. Hi, I understand that your baby has jaundice and requires phototherapy.
Yes, is it necessary for my baby to stay in the hospital?
KKH now offers home phototherapy as an option. It allows the baby to receive treatment in the comforts of their home. Parents can manage the treatment in a familiar and less stressful environment, reducing the potential discomfort for both the baby and the family. Generally, home phototherapy is as effective as hospital-based phototherapy. What is the difference between phototherapy in the hospital versus at home? In the hospital, the baby will be nursed in a shared cubicle space with other patients and caregivers. The visiting hours are between 10 a.m. to 8 p.m., and only one accompanying caregiver may stay overnight with the baby. Vital signs and intake output monitoring will be done by the nurses in the ward. As in a hospital setting, assistance and attention by the healthcare team will be available 24/7 on site. In the home setting, the baby will receive phototherapy treatment at home. The phototherapy equipment will be delivered and set up at your home. Instructions on usage of the machine will be given by the vendor. Parents and caregivers will be able to be with baby throughout the phototherapy treatment. The jaundice blood test for baby will be done at home by a nurse performing house visit, and consultations will be done virtually via the Zoom platform. In terms of monitoring of baby, 3 hourly temperature checks for baby are to be done by parents and/or caregivers. Parents are to submit temperature readings, milk feedings, and diaper changes using Form SG for remote monitoring by the healthcare team. Parents and caregivers are to also monitor baby for any changes in medical condition, such as fever, breathing difficulty, lethargy, poor feeding of less than 50% of usual, extreme irritability, inconsolability, increased yellowing of skin, and/or pale-colored stools. A 24-hour hotline will be made available for assistance. In the unfortunate event, if baby turns unwell, the baby will need to return to the hospital for admission. Parents will be advised via the hotline in such circumstances. There are 2 types of phototherapy machines available for home treatment. The type of machines used will be issued according to your baby's treatment criteria. You will be advised accordingly during the recruitment process. So, what should you expect? On day 1, the day of admission, the phototherapy machine will be delivered to the house where baby will be receiving the treatment. Parents are to start baby on phototherapy once the machine arrives. On day 2, a nurse will conduct a home visit to perform the jaundice blood test for your baby and deliver the blood specimen to the KKH laboratory. Subsequently, there will be a video consultation with an advanced practice nurse or doctor to update you on the baby's jaundice results and plans for the baby moving forward. On day 3, if baby's jaundice level has come down to safe levels after receiving adequate phototherapy, the baby will be discharged from the home phototherapy program. A memorandum to the polyclinic will be emailed to you on discharge. Parents and/or caregivers are to bring baby back to the polyclinic for follow-up and repeat jaundice check. This will be advised accordingly during the video consultation. The phototherapy machine will be collected by vendor after discharge from the program. Some common scenarios requiring U-turn back to the hospital: persistent crying under home phototherapy, and parents are unable to console baby; persistent fever, lethargy and/or poor feeding, that is poorer than baseline; vomiting and/or diarrhea; baby becomes increasingly jaundiced; baby develops pale-colored stools; and of course, lastly, if baby's jaundice does not come down to safe levels despite home phototherapy. This virtual admission is Medisave and insurance claimable. Based on an estimated 2-day admission, both costs are comparable. Apart from milk feeding, diaper changes, and bathing, your baby should be under phototherapy for as long as possible during her duration of treatment. Here are some of the positive feedback our program has received. If you are interested in having your baby receive phototherapy treatment at home, please approach our staff for more information. This video is brought to you by the KKH Home team at KK Women's and Children's Hospital.